Do you really know the difference between a seizure and epilepsy? We're headed into a study of electrical activity in the brain that's excessive that leads to disability, and namely the condition of epilepsy can be indicated by a series of seizures, but a seizure in and of itself is not epilepsy. Seizures can be caused by any number of different conditions that we'll deal with in just a second. So the operational definition of seizure is sudden excessive electrical discharges by large aggregates of neurons. Could happen once. Might not have ever had a seizure before, and somewhere in adulthood it can manifest. Might be the last seizure the person ever has. Idiopathic, how do you trace it through? This is a big deal because a person who has repetitive seizures, who is a person most likely going to be diagnosed with epilepsy, which is chronic seizural activity, loses some independence, because a person who has been diagnosed with epilepsy is not allowed to drive or use heavy equipment or be in circumstances where perpetual alertness is required. And so knowing the difference between seizure and epilepsy is way important. Things that may lead to seizure could have to do with anomalies of the central nervous system in the brain, infections, space-occupying lesions, and I think at this point in your development you can come up with a list of space-occupying lesions. We've just been talking about abscess, neoplastic changes, bleeds, hematomas in the brain, subdural or epidural, or transdural. Fever can cause epilepsy. When our youngest daughter was a little pup, she was under a year old, my wife looked in the rearview mirror. She was in the car seat. Back then car seats faced forward. I guess, yeah, a little, anyway, let that go. And she was having a hemiplegic seizure on one side of her body, and it was a febrile seizure caused by her elevated temperature, and had to be on anti-seizural medicine for a period of time. And then for whatever reason, the central nervous system not having enough oxygen, could be ischemia or hypoxia. And then low levels of sugar, calcium, or excessive amounts of sodium can lead to seizure. Could be genetic, could run in the family, it could be idiopathic, we don't know. On the PowerPoints in E-class, I've provided for you videos that will allow you to see these different types of seizures. I think it'd be worthwhile for you to watch them. You know, a video is worth a whole bunch of words. Not going to spend some time talking about different types of seizure, but for you to be able to see that seizural activity, that would be worthwhile. Right now I'm going to manifest a seizure. Okay? Watch your screen closely. That's an absent seizure, and some people call it a petit mal. Some people say petit mal is how I pronounce it. And during that seizure, you wouldn't have been able to get my attention. I come out of that seizure and I won't remember the seizure. I might realize that if I'm in a Bible study or in a class or in a conversation, that somehow I've, you know, lost attention and I'm out of phase with what's going on. This is the student who gets labeled a daydreamer. Elementary school, chemistry lab, right? It's like, hey, sweetheart, you're tuning out. You need to be focused, and so forth. If this happened to you in a group setting and you're suspicious that a petit mal seizure is underway, you get right up next to them and come up underneath their elbow, put your arm around them maybe, and just gently call their name. And let them write it out. They'll come back, and that needs to be followed up. In fact, when I was a high school teacher, there was a young man who had a history of this, and it turned out the science teacher was so fed up with him, and one time prior to a football game, it had escalated to a bigger seizure, and I'll talk to you about grand mal seizure, and that's when I realized, I put two and two together, that he was having hyperelectric activity that manifested as an absent seizure and then had become something greater. Myoclonic seizure can affect one or all of the body. It's a rapid onset, and this is noted by muscular contractions. An atonic seizure, or a Lennox-Gastaut seizure. I'm going to demonstrate the Lennox-Gastaut. The person knows that something unusual happened because they activate the myotatic stretch reflex. When they lose consciousness, they'll come back up. Somebody who's not strong may lose their balance and fall. This is the Lennox-Gastaut. They know something happened, and in a little kid who's not sure what to say or to whom to say it, might just keep it to himself, or a person with a greater capacity to create a strategy may fake that they're going down to pick up something or to tie their shoelaces. This is a type of seizure where there's loss of postural muscle function, so it's like they're going to collapse, but the seizure is just split second long, and then they come back. This has to be medicated for the health of the person. And then typically when you talk about seizure activity or epilepsy as being a series ongoing set of seizures, this is what is thought of, the tonic-clonic or the grand mal seizure. There's two phases of it, the tonic phase and the clonic phase. We'll talk to you a little bit more about those two phases in just a second. But a person who has had a seizure previously will know when the next one's coming, or most likely know, because they have an aura which is prodromal to them actually having the seizure. And it's a feeling or a taste in their mouths or a light in their eye. They may have an overall feeling that, ooh, something's going on. There are some people who might not be perceptive, and they have a care dog who's trained to sense the seizure. The dogs can sense the seizure before the person, and that dog would come and get up next to that person who's about to have the seizure. That's the signal. Now you need to sit down, lay down, and so that we don't end up falling and hurting our head. So that's the aura. I also include here that when we talk about migraine headache, very often there's an aura that's prodromal to the onset of the migraine. Well, back to tonic-clonic. The tonic phase is a time of great rigidity. Let me go back to aura. In lab, in class, we'll practice what our responsibility as the companion, the caregiver of someone who has epilepsy, and they say, I'm about to have a seizure. We're going to practice that because it's not time to appeal to them to have their seizure at a later time in a more convenient place. You've got to use good technique so you don't get hurt and they don't get hurt. We'll practice that. But I want to jump over that because that's best done in person in contact with a partner in class. So the tonic phase, they're down now, and they'll stop breathing. As a result, they'll become cyanotic. It may very well be that as this tonic phase starts, they'll yelp, they'll make a little scream, and most likely they're going to lose bowel and bladder control. And so what we do is, this is, if you haven't seen it before, it's dramatic. It elicits an emotional response in whoever's around. And you need to do crowd control right then. You stick with that person, be at their head, let what comes next come. Nothing you can do to make it quicker or go away or ease it. That seizure just needs to run its course. The next phase is the clonic phase. They'll begin to breathe and they'll have rapid repetitive movement, typically into extension. Yes. My strategy, because I've had to deal with this a fair number of times, is that I go to the head and I direct traffic around me, crowd control. I'll have this person direct people this way, this way, this way. If we know the person's background, we're not going to call EMT at all. This is contained here. If it's somebody you don't know, they don't seem to have support by anybody, or if it's their first seizure, we're not sure why it's seizure. Could be a brain tumor, could be radical dehydration, could be metabolic. Then we have to bring in the possibility of bringing in the EMT for transport. So in the clonic phase, they'll begin to breathe. They'll have thickened mucus as they breathe through their mouth, and that's why in old wives' tales they foam at the mouth. It's just thick mucus. And it may be that when they were in the tonic phase, they bit their tongue, and there could be some tinging of blood in the sputum. Status epilepticus is the only true emergency related to epilepsy, and this is unremitting seizures. This is obviously a medical condition, and if that seizure lasts longer than 90 seconds, you've got to call 911. And then those who have epilepsy and know what the triggers are, you can follow here. These are some of the things that could set people off. I'll let you study this. It may very well be that when a person just gets to the end of their rope and they're way stressed out, that means they need to balance their life. Or there may be things that come through their eye gate or their ear gate, or rapid temperature change or altitude. Then those have to be managed. So looking forward to being in lab with you, and we'll practice what to do in 3 of these different seizural activities when you're right in the classroom or on the playing field or in the exam room at the clinic. I want to move now to headache. If a headache occurs in these 3 circumstances, you need to suspect that there's a structural lesion. This isn't a tension headache. This isn't because I'm tired. This is because there's something going on in the brain that needs to be addressed. And it needs to be diagnosed, and it needs to be appropriately addressed. If the headache wakes the person up, if it's triggered by exertion, or it causes drowsiness on the other side of the headache. A migraine is a one-sided headache, and it's due to changes in circulation. Initially, there is an increase in circulation followed by a decrease of circulation, and the decrease causes a cerebral hypoxia. Causes of this are listed for you here. It may be food allergies, alcohol consumption, hormonal swings related to menstruation, or the side effects of contraception, or the outcome of pregnancy. Could be sleep related, it could be stress related, it could be hypoglycemia. A person who experiences migraines is called a migraineur. Again, auras, and these are warnings that a migraine is coming. I'd like you to address this. I had a student who described this to me one time. Coog, I can't see anything right in front of me. What is it? She never had it before. And, you know, this could be indicative of the first signs of a very radical brain problem, a tumor. So that has to be checked, no doubt. But this was the first time she'd had a migraine headache, and she had the visual disturbance. It might lead to paresthesia, tingling around the face. They might be restless or irritable or depressed coming into and on the other side of that headache. And a common migraine is a bilateral migraine, and these are some of the neurologic symptoms that can manifest.